Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Thank you, everybody, for being here today. This is a very important topic for us to discuss, especially when we are going through such an economic recession. By aging healthy, we can probably save a lot of money for Medicare, and probably Obama will be a happier camper. So with that, let's get started. I have some information with my email address and my website. In case some questions arise after the presentation, you can feel free to email me. So let's get started. The first thing I wanted to mention is aging is inevitable. We will age, and all of us have a lifespan that we will be living, and there is someday that the end will come. But what we can do is age more healthy so that we have happier years, more productive years, and more happier life. And I will go over how we can increase the lifespan at the end of the slide, but I think the most important thing is to age more healthy. And then we can go over the longevity too. So age is inevitable, but we can age more healthy, as I mentioned. Age-related diseases are preventable. So I'm going to go over all that. I will be presenting a 6-step healthier aging plan, 6 pillars to healthy aging, which you can actually start applying this from today itself, a lot of it, which will be which are in my slides and which I'll be talking about. So what is aging? I think in my point of view, this is aging. If I can't walk and I need a wheelchair, I think that's not aging very healthy. If you can't breathe without a machine, I think that's not aging very healthy. So aging is the process by which we gradually weaken and lose our body function. And anti-aging or healthy aging is where we can understand the process and intervene to preserve the youthful characteristics in our body. We can preserve those for a longer amount of time if we can apply some of the things that we're going to talk about today. So before we get into the actual facts, I wanted to go over some statistics from CDC, Center of Disease Control, about the economic effects of aging society. Medicare, about 25 years ago, it was spending $37 billion in 1980, about actually 30 years ago. And in 2005, the stats on CDC mentioned they are now spending $336 billion. That's in 2005, so it must be much higher now. So you can see how aging can actually, because Medicare is usually, older adults are on Medicare, so how we can actually prevent a lot of money to Medicare by aging healthier. If left unchecked, by 2030, the increase in the Medicare spending will increase by 25%. So this is another slide from CDC. So what are the diseases which actually cause unhealthy aging and cause problems and ultimately death? Is heart disease is the #1, and then cancer, stroke, lung problems, memory problems like Alzheimer's disease, diabetes, etc. List goes on and on. Economic effects of aging society are actually going to even get worse and worse as we actually go on with our increased technology. A lot of EMF, electromagnetic radiation, a lot of toxins in our system, in our polluted air, water that we drink. So I'm going to go over all that. So today, about 80% of the older adults have at least one chronic condition, and at least 50% of them have at least 2 chronic conditions. I'm going to present a case first because that gives you a perspective how we can change the way you have. So if all of you here are looking for better ways to age. So here I'm going to present a case which might tell you how a little bit different approach might help a little better. So this is a case of Miss B. She's my patient, 58-year-old. The first visit, she came in with complaint of severe fatigue, unable to do her daily household chores, knee pain, low back pain, insomnia, cannot sleep, anxiety, depression, palpitation, low sex drive, memory impairment. Also, she has been recently diagnosed with diabetes, hypertension, and high cholesterol. And her doctor has put her on several medications to help with all those things. So she has been on Lipitor for her high cholesterol. She's on amlodipine, which is also called Norvasc, for her high blood pressure, metformin, glipizide, and Actos for her diabetes, Ambien for sleeping. I think you might be familiar with these. These are very common medications most of the people are usually on. And Xanax for anxiety. And also, the list continues because she has all this back pain, knee pain. She's on some painkillers and muscle relaxants, which are Vicodin, Naproxen, Flexeril for her pain, and that does help with her pain for a few hours. She is also on Fosamax for her thinning out bones, for her osteoporosis. Also, she takes Perlisac, which is over the counter, and Tums for her heartburn. And also, she has had history of constipation for the last few years, so she ends up taking Miralax and Dulcolax and several other over-the-counter laxatives. So after taking all these medications, she still does not feel well. That's the big question. She's on so many medications, she doesn't still feel well. Ended up seeing a psychiatrist, thinking it's all in her mind. She was started on 2 more medications to sleep better and to hopefully help with her depression and anxiety, Prozac and Seroquel. So she comes in with 17 prescribed medications for her that she's taking very regularly. She's very compliant with her medications. She takes them very religiously every day. She used to exercise in the past, but because of her back pain and knee pain, she has not been able to exercise. And because of depression, she's on a C diet. I call it a C diet. She sees that anything that she sees, she thinks that might make her fatigue better, she eats it. So she has gained a lot of weight. So about 12 years ago, she was feeling much better. Right now, she's 58. So about 12 years ago, she was about 46 years old. And let's see what we can do for her. First of all, I wanted to kind of make this more, you can write your questions for the end, but wanted you to think about what do you think is wrong. She's on 17 medications. I think she should be feeling the best she can. She has everything available to her for all the symptoms she has. Anxiety, there's a pill. Depression, there's a pill. We have a pill for everything. So what do you think is her future? She was very worried. She has her mother and aunt who actually at about age 67 were in the nursing home and passed away at age 72. So she brought me a picture of them, and she wants to make sure she doesn't end up there. So she's trying to make her life a little better. So that's their picture. She was okay to have me share this with you guys. So this is what I call unhealthy aging. 17 prescribed medications, still have most of the symptoms that she probably could have, and doesn't feel well, is not able to do her usual stuff that she really wants to do. This is, I would call it unhealthy aging, and we're going to go over how she can age more healthy. So let's talk about what is aging. Aging is a condition which is treatable and very easily treatable. It's actually much cheaper to age healthy. It's much more expensive, especially today's recession. It'll be actually much better to actually improve our lives so that we can actually save for money, some money to Medicare. So let's see what happens to Miss B. So we did some blood tests on her, tested all her hormones, checked a lot of her vitamin levels, and also checked few other markers of aging, for example, HSCRP, acid rate, homocysteine levels. I'm going to go over that later. So she got a blood test done which she had never had done before. She had her cholesterol checked, everything, blood counts, comprehensive metabolic panels, and thyroid, everything was checked before. So these were the new tests for her. So we got those done, and let's see what happens to her. She was found to be very low in estradiol, progesterone, DHEA, and testosterone. Also, she was very low on vitamin B12. Her levels were 33. And a normal level should be about 600 or 700. Also, she was very low on vitamin D. The levels were 4. The ideal optimal level is 80. And also, she was borderline low on thyroid with very low free T3. I will go over thyroid later, but the free T3 has to be normal. TSH and free T4 normal does not really help. So let's see what we did with her. Her regimen was started. She was started on a low-dose bioidentical hormone replacement treatment with biased cream, progesterone slow-release bioidentical hormone capsules to be taken at bedtime. Also, she was started on low-dose testosterone, Cytomel, which is T3, available from any pharmacy, and DHEA. Also, she was started on digestive enzyme and betaine hydrochloride for proper digestion. Vitamin B12 was replaced in the form of methylcobalamin in the form of injections. Most of the people, especially above 50, do not absorb B12 because they lack something called intrinsic factor. But I'll go over that, but let's see how Ms. B feels after adding all this. Vitamin D was added because she was very low at a higher dosage of 10,000 international units every day for a month, and then she was reduced to 2,000. Once she was feeling slightly better in about 3 weeks, so we also started her on a 21-day detoxification program to clear out her colon and her tissues. So how do you think she feels after all this? Let's take a look. First thing that got better from the first day was her sleep and anxiety. She did not need her Xanax and Ambien about a week after starting all this. Next thing that got better was her depression and low sex drive and fatigue. See, what we did was we replaced what was missing. You know, she wasn't missing Xanax and Ambien in her blood. She was missing something else, which was replaced. So she did not need her Seroquel Prozac and felt much better. Over next 3 months, her knee pain started to feel better. When bones are thinning out, you're having osteoporosis. Obviously, the knees are the ones which actually take all your weight on, and if your knees are not strong, you're going to have knee pain. As we replaced her natural hormones, she started to have stronger bones and started to feel a little better as far as her knee pain. With improved depression, anxiety, and knee pain, her relationship with her spouse and the sex drive, everything got better. So she really started to feel much better. So she started to watch her diet now. If you're not feeling better, it's hard to stick to a good diet regimen. So she started dieting, eating a proper diet and exercising. So about 9 months later, she has stopped all her 17 prescribed medications. And the only thing she's on is what she was missing. Vitamin B12 in the form of injections because she doesn't absorb it, biased and the progesterone, a balanced exercise and diet regimen, and an exercise prescription that was given to her, and also a prescription strength multivitamin. And she doesn't have any of the symptoms that we did talk about. And that's her picture, biking with her husband. So, this is not a magic. It's just we are simply addressing what's missing instead of covering up the symptoms and added a healthy lifestyle. So again, which I already had said, aging is a process where we lose our function and our body gradually weakens. Healthy aging is where we seek to reverse that process or at least control that process and to preserve youthful characteristics. To do this, we do need an integrative approach. We do need what we already do, the conventional approach, but we do need some alternative therapies. The therapies which look at the underlying problem is what we need, and an open and receptive mind to accept that. We are so used to taking an Ambien or a Lunesta for not being able to sleep instead of looking, why can I not sleep? That is such a common thing that most of the people sometimes are not open to these ideas. To age healthy, we do need to open our minds to the new research and new data out there. Whatever I'm going to present is all from all the reputed journals. There's a lot of research available, and I can email you all the research papers and the actual the articles to you if you want to read more. But everything I present here is all scientifically proved. So again, treating the root problem is the key to health, to age more healthy. So treating the root problem, as I said, does not mean replacing or giving Ambien to sleep better and lorazepam or Xanax or Ativan for anxiety and Prozac for depression. That's not treating the root problem. So I want to get that into your mind that we have to get to the underlying problem. Fosamax for osteoporosis is not really treating osteoporosis. It's actually just suppressing it for a few years. And also purple pill, the most common ad I see on TV is that purple pill for heartburn, but we need to look why heartburn and treat the problem. Purple pill just suppresses the symptom. So let's look at what happens with normal aging. The metabolism goes down, slows down. Mental acuity goes down, so start to forget things. A lot of hormones start to decline. Growth hormone, melatonin, sex hormones, they all start to go low. Good cholesterol starts to go down. You might be exercising pretty good, but still you'll see your HDL numbers going down. Lean body mass starts to go down. Digestion starts to be bad. Actually, the body doesn't digest all the nutrient or the good foods that you eat, all the salads and the fruits that you eat. Sometimes it doesn't get actually digested, so the body doesn't really get it. So the absorption of vitamins and minerals actually goes down, and with that, obviously, libido goes down. What starts to increase is the lethargy, weight gain, abdominal fat, insulin resistance. Cortisol, blood sugar starts to go up, disease susceptibility goes up, wrinkles start to appear, heart disease, Alzheimer's, Parkinson's, everything starts to go up after somebody has been in their 50s or above, or some people even before that, depending on how their lifestyle is. Risk of cancer goes up, atherosclerosis, clogged blood vessels, heart attack, etc. List goes on and on. So I'm going to go over how can we divide aging. Aging doesn't start at 50 or 40. It actually starts when we are born. We can actually divide aging into 3 phases just for so that we can put that into perspective here and help how to age more healthy. So 3 phases: subclinical phase, where we are not aware of our aging process. We feel pretty good, and then there's a transition phase, and then there's the phase that we actually see the symptoms of aging. So the subclinical phase between 25 to 35. Most hormone levels start to decline after age 25. Growth hormone levels have fallen about approximately 14% by age 35. So all the pollution, poor diet, and stress, and free radical damage, everything is going inside. But a 25-year-old or a 30-year-old feels pretty good because your body still has some flexibility. Detox system is still probably working some. And so the symptoms are not really getting to the surface. So outwardly, there are only very few symptoms for a 25 to a 35-year-old. They look and feel pretty good. But what happens in transition phase? All the abuse and all the things that were actually happening inside the body between 25 to 35, after 35, they start to surface. People start to see more symptoms of aging. Hormone levels have fallen even further, and biomarkers of aging and the signs are starting to appear. Clinical symptoms like visual acuity, graying of hair, increased pigmentation of the skin, decreased strength and energy are making their presence felt outside. This did not start that time. It started probably 10 years before that. So on the insides, the cellular damage from free radical continues, where the rate of damage depends on your lifestyle. If not controlled or slowed, mutational changes can lead to cancer and other stuff even earlier. But the chances of all these happening is more after age 45. So clinical phase of aging, above 45. So most of the hormones are declining, including DHEA, melatonin. We'll go over what these are later. Growth hormone, male and female sex hormones. The rate of decline accelerates as we get older until age 70 or thereabouts. And just to give you a perspective, melatonin is almost 0 by age 60, so that's why a 60-year-old cannot sleep. Melatonin is the most potent antioxidant and immunity enhancer. That's why more cancers after that age. So, but then we need to check the levels, and they have been checked. A lot of research behind everything what I'm saying. So early signs and symptoms of aging are, which were seen in the transition phase, continue to get worse after age 45, and collagen fibers in the skin start to break down, wrinkles start to appear, So everything is surfacing out, but it did not start then. So we need to improve. We start to anti-age or age healthy since we are born, or especially after age 25. So musculoskeletal joint degeneration, arthritis starts to show up after age 45, fatigue, loss of energy, chronic illnesses such as high blood pressure, diabetes start to be more apparent after age 45. Inwardly, as our cells succumb to free radical oxidative damage, atherosclerosis, which is clogged blood vessels, which means some heart problems can arise, strokes can arise, cancers can arise. So all that starts to be more apparent, but it did not start then. So I'm going to go over to the next case to give you more perspective of healthy aging. Case of Mr. Ed, 69-year-old gentleman with complaint of palpitation and anxiety for 3 years. He's overall very healthy. He says he's pretty good. You know, he's able to actually water his plants every day, and he's able to sit in front of TV, and you know, so he's able to do all that. But a lot of things which he really wanted to is not happening anymore. He has had erectile dysfunction for 2.5 years. He has been very forgetful. Sometimes he gets into his car and was planning to go to Safeway, but ends up at Trader Joe's, forgets where he was going. Generalized fatigue and pain in multiple joints for last 9 months. But the main problem he was worried about is that his favorite activity was to dance, go dancing with his wife, and he's not able to do that anymore because of all the pain that he has, and all the medications that he's taking is not helping much. So his list of medications, verapamil for blood pressure. Verapamil does cause sexual dysfunction also. But he might have other problems why he has that. But just to mention that verapamil started at any age will cause erectile dysfunction. Paxil and Ativan, he's taking that for anxiety. Atenolol, it's a beta blocker. This is a medicine that slows down the heart. He's taking that for palpitation. He's also taking some pain medicines and muscle relaxants, which are Norco, Soma, Celebrex. Also, since he is forgetting a lot, his doctor has given him a prescription for Aricept, thinking it might be mild Alzheimer's starting up. He also takes Viagra for erectile dysfunction, does not help much. Lipitor is for his cholesterol, and he also takes Tylenol PM to sleep. After all this, he's still not feeling too good, and also he had a recent angiogram. That was his wake-up call. He was told that he does need angioplasty because he has clogged blood vessels. So he saw his wife's doctor, and some workup was done. His hormone levels checked, his thyroid checked, his homocysteine level checked, his bones checked for osteoporosis. And we found that he was low on most of those things. Those were checked. Bioidentical testosterone was started. DHEA was started. Low-dose Cortef was started. Also, in male, actually the female hormone, which is estradiol, which women really need badly, it goes up for men as they age, and that is what causes prostate problems and can also cause atherosclerosis. So his estradiol levels were high, so he was given Arimidex, 0.5 milligram twice a week to keep that down. He was very low on B6, B12, folic acid, and coenzyme Q10. So the Lipitor that he takes, actually that blocks coenzyme Q10, and that's the main thing in the cells which helps produce the energy molecule, which is ATP. So he was low on all these things. So he was started on all that, and also after he was slightly better, he was done. He underwent a 21-day detoxification cleansing program, and he started to feel better about 3 weeks into the program. Now he was prescribed a balanced diet and exercise, and also, since he had a lot of clogged blood vessels, he was started on chelation therapy. Chelation therapy is an intravenous treatment which is to dissolve the clots or the atherosclerosis that's building up in the blood vessels. So 3.5 months later, his most of the signs and symptoms were improving. His Lipitor, Paxil, Ativan, Viagra, Norco were stopped. He did start to take some more supplements. Melatonin was checked in a saliva level done at midnight, and it was almost not there, so he was started on melatonin. Ginkgo, vinpocetine, and L-arginine were started. 7 months later, he did not need his blood pressure pill and his Aricept. Also, his symptoms from his first visit were all resolved. a repeat angiogram was done and did not need angioplasty anymore because his blood vessels were clear of the atherosclerosis. So again, this is not magic. We treated the underlying problem. This is how, we can learn how to age more healthy. These examples set us to think and makes us think better that how can we make our life better. But the most